Video about STIs that include HIV and AIDS. The Center for Disease Control lists the following diseases, ones that are linked to HIV. They are syphilis, gonorrhea, and herpes. Fact: if a person develops an STD, the person has a greater chance of getting HIV than a person who does not have an STD. What are some of the behaviors that can actually make a person who is at risk for developing this disorder? They are engaging in sex without a condom, having multiple sexual partners, having partners that you do not know for sex, a person who has sex while he or she is drinking. What are some things a person can do to decrease their chance of developing HIV and AIDS? The first one is make a decision to practice safe sex. So it's important to use a condom at all times when having sex. And if you're not aware of how to apply condoms correctly, there is information on the CDC website about how to do this. The CDC recommends that people should decrease the number of sexual partners they have sex with. The Center for Disease Control suggests that people limit or abstain from alcohol or drugs when having sex. Ask your healthcare provider if he or she feels that you need to be tested for STDs and HIV. If a person is HIV and then contracts an STD, this can place the person's sexual partners at an increased risk for developing the HIV virus. Another fact is that if a person seeks out treatment, this will prevent the person from developing complications and also help to stop to spread the disease of HIV, according to the Center for Disease Control in 2016. It is crucial for everyone who develops this disease to discuss it with their physician or healthcare provider about how they can safeguard themselves and their sexual partners. Women are able to contract STDs, so there is not any special protection just because you are pregnant. It's important for women who are pregnant to be tested for HIV and AIDS. Quite a few of the problems that women who are pregnant can face can be dealt with best by receiving medical care during pregnancy. So women should be tested for HIV at the beginning of pregnancy and then close to the time the baby is born. The CDC in 2016 says that quite a few STDs can be treated with medications that are called antibiotics during pregnancy. Some of these diseases include gonorrhea, syphilis. Let me start over. These include chlamydia, gonorrhea, and trichomonas and BV. STDs that are viruses including genital herpes, hepatitis B, and HIV are STDs that are not curable. However, some of these STIs can be treated with antiviral medications or some other preventive measures to help lessen the chance of this virus being transmitted to the baby. There are two things that expectant moms can do to prevent their chances of getting an STD when they are pregnant. The first one is use latex condoms when you're going to have sex. The second one, it is recommended that pregnant women abstain from having sex to avoid contracting STIs. If women are going to have sex, it is recommended that they are in a relationship that is monogamous or with only one partner where the woman's significant other has been tested for STDs and the results were negative. In fact, according to the CDC, every woman who is pregnant needs to be tested as soon as possible for HIV to help prevent the disease from being transmitted from mom to baby. The good news is that when women receive treatment early in the pregnancy, the dangers of the STI being transmitted from mother to child is actually less than 1%. Some more encouraging news is that with the treatments that are now offered, quite a few people who actually contract the virus are able to now living as an adult. Some More specific information about HIV and pregnancy includes the following. The type of disease transmission is called mother to child. The disease can be transmitted anytime during the woman's pregnancy, birth, and also during breastfeeding. The type of medication that is given is called antiretroviral medications. These are beneficial because they help to prevent transmission of the STI and also help with improved outcomes for both mom and baby. Some additional encouraging news is that according to the CDC in 2016, advances in HIV research, prevention, and treatment have made it possible for many living with HIV to give birth without transmitting the virus to their babies. HIV infections through perinatal transmission have declined by more than 90% since the early 1990s, while the number of HIV-infected women has increased. So today, if women take HIV medications exactly as prescribed through pregnancy, labor, and delivery, and provide HIV medications to her baby for 4 to 6 weeks, the risks of transmission can be less than 1%. In some cases, a cesarean delivery can help prevent transmission. After delivery, a mother can prevent transmitting HIV to her baby by not breastfeeding and pre-chewing the baby's food. A woman who is pregnant needs to talk to her doctor or healthcare provider if she is HIV negative and her partner is HIV positive about taking medications called pre-exposure prophylaxis. This can help to protect the woman who is trying to conceive and also protect the baby while she is pregnant or breastfeeding. Some important statistics from the Center for Disease Control for 2016 is that approximately 8,500 women living with HIV give birth annually. Most 73% of the estimated 174 children in the United States who were diagnosed with HIV got HIV through perinatal transmission. This is some sad news about the deaths. An estimated 4,998 children ever diagnosed with AIDS have died since the beginning of the epidemic through the end of 2013, including only those under age 13 at the time of death. Almost all of them, 91%, got HIV through perinatal transmission. Women living with HIV can learn what to do to lower their risk of transmitting the virus to their babies. Women can take their antiretroviral treatment or ART for their own health if they think that they might want to become pregnant after delivery. Ensure the infant takes HIV medications. Avoid breastfeeding. Avoid pre-chewing food for an infant, toddler, or anyone else. The risk of perinatal transmission is much higher if the mother's antiretroviral treatment is interrupted anytime during the pregnancy, labor, or delivery, or if the medications are not provided to the infant. Pregnant women living with HIV have nausea during pregnancy that can interfere with medicines. A new mom may not be able to see their HIV medical care providers all of the time. Social economic factors, especially poverty, affect all healthcare and disproportionately affect people living with HIV. Pregnant women with HIV may face more barriers to accessing medical care if they use injection drugs, abuse other substances, are homeless, incarcerated, mentally ill, or uninsured. According to the Center for Disease Control, HIV stands for human immunodeficiency virus. It weakens a person's immune system by destroying important cells that fight disease and infection. Some more information about HIV. HIV is a virus that is spread through certain body fluids that attacks the body's immune system, especially the CD4s and often T cells. Over time, HIV can destroy so many of these cells of the body,